creating infrastructure and the right strategy and gain trust again can also, on the other hand, cause for burnout of all the people involved, actually, in what happens, because they have to work nonstop, 24/7, and to be attentive all the time, to solve all the problems, to be very resourceful with everything that is needed, to work without resources. So on the one hand, we are very agile and we know how to address things, but it has its toll. So how did you, part of the government and also in the hospitals management, how did you address it and how do you address it still currently with all your professionals and doctors and all the team that has to give the solutions to the people?
Yeah, it was a challenge through the corona, but on the broad spectrum is a daily challenge here because the Israeli healthcare system is overloaded, is crowded, and the tasks are, endless tasks, and we are mainly out of the corona crisis in a very different kind of employment culture, and we have to address burnout all through the days, all through the years, but mainly now, post-corona, they work very hard, and they are overloaded, they are burned out, and we have to be smart in the way that we move them ahead, giving them the right climate, the right atmosphere, addressing their frustrations from lack of resources, their frustration from the overload. And you know what? The most important tool to do so is giving them the pride and the spirit that they are working in the most advanced technological hospital system. They are moved through the fact that they are trusted. They give the support from the entire state of Israel is huge. They feel that they are doing a change, and you have to keep on putting resources, talking to them, moving them, and you cannot let your VPs to do that. You, as the CEO, must come closer as a leader, to these people, to your physician, nurses, any healthcare worker in your organization, address them, give them the right support, and understand that burnout is a real challenge you have to address. It's not just, generation X, Y, or Z. This is confront anyone that works in the healthcare system, and we must address that. This is what I'm doing daily. This is part of my challenges.
So that's really, we're Israelis, so the IDF is really common ground for all of us. It's a little bit like the Acharai, like come after me and I will lead the way. It's a little bit like that, and Ofir will...
That's the way.
Expand on it in a second, but tell me, Ronni, when you're having such a big system, such a big hospital system and so many stakeholders involved. So on one hand, that's what we should do. We should gain trust. We should support them. We should let them feel pride in what they do. But in the day-to-day challenges, when you need to make decisions, when you need to make organizational changes within the hospital and the way it works and the various departments. So how do you do it really in the day-to-day, like tachlis? How do you really do it?
First key factor, there's no I, we, or them. There is all of us together. Leadership is all about moving the people with the right senses of, inspiration, letting them be involved. They are the management as I'm the leader. They are the leaders as I'm their servant. This is the way to go. We are a group. We are going to conquer the horizon. We are putting an horizon, a very high-level aims and targets. We will not reach them, but we will follow them. We will be decisive to reach them. We still will reach 80% of them. So you have to do daily this kind of understanding, talks, conversation, getting all your employees, mainly your leaders, become your leaders. We are all together in this task, and you have to build up pride. you have to build very kind of a unity and support them all. And this is what I'm doing daily in the hospital in order to reach the goals that I'm putting ahead. It's a daily task. This is what requires from us leaders. Don't be afraid. Do not fear from the challenge. Go ahead. They will be with you. And this is what we are doing.
You know, Gali, I have to be humble when I'm speaking about healthcare next to Professor Gamzu, but in the last few months, we probably met hundreds of healthcare professionals, attendees, residents, nurses, and we hear similar things from bottom up as well about how much work load they have, how much the leadership is important, and they actually say that they think important part of the success of the Israeli healthcare system, although the low resources, is the great leadership they see. And I agree that, you know, maybe adding the right technology to that could be really, really helpful. From at least that's what, like, the highlights of what we heard.